Mr. President.
Senator from North Dakota.
Mr. President, I think that anyone who picked up the Wall Street Journal in the last couple of weeks and read the stories about Indian health and what was happening, especially in our region of the world in the Great Plains, it shocked the conscience. It should have resulted in a prolonged level of outrage that would bring us all together. Unfortunately, we've seen this movie one too many times. Things happen where we see national stories about challenges in Indian country, about failure to fulfill commitments under treaty rights. We see despair. We see the incredible rates of poverty, the incredible rates of unemployment, even in a state like ours where unemployment rates are never the issue. And we wonder, why isn't something being done? Guess who wasn't shocked? Those of us who serve on Indian Affairs, who spent a lot of time looking at this last year and trying to figure out how we could engage the bureaucracy to be more responsive and more responsible, but how we could look at sourcing and dollars that we needed to make sure that Indian health was supplemented, and that level of care that we expect when we walk into our hospitals, that's a level of care that Native American people who go to Indian health services on their reservations, and also who might go to an Indian a tribal run facility would expect. That's what we expect. I think that's what the American public might think is actually going on. But those of us on the committee know differently. We held a roundtable today to talk about what those challenges are, what Native American leaders believed were those challenges, and to ask them a simple question. What has Medicaid expansion meant to your tribes? What does access to Medicare and Medicaid meant for delivery of healthcare services? And I want to just start out by saying they had a lot of really great ideas. And I want to just run through some of these. Chairman Kaplan from Turtle Mountain said, we need local doctors. It's hard to get people to live on the reservation if they're not from the reservation. So we need to figure out how we're going to get local folks to be trained, and we're willing to do that in our tribal colleges. And we need to build relationships with other healthcare providers like Sanford, who can bring specialists. And we need our Cancer Infusion Center to be there so that people can get cancer treatment right at home. And we need to make sure that we're doing everything that we can to make sure that we can treat diabetes right there at home. And so the healthcare challenges were amazing, but the cost challenges were also amazing. Dwayne from a Pueblo in New Mexico, he had some really interesting perspectives. 80% of his patient load come to the clinic. They speak their native language, and they've had stability in their workforce, but they're looking at transitioning to a tribal facility. But those people don't want to transition because of federal retirement. And so is there something we can do to keep these treasured healthcare providers working for the tribe and working for their people, the people who know the language, who are familiar with the case study? Lincoln from Alaska said, you know what, one of our biggest problems is year-to-year funding. VA has 2-year funding. We don't know what the money is going to be and when it's going to come. And we also need to train local people. Sam said we have a huge need to continue to build out our cultural resources and our attention to culture and prevention. Washington, Ron talked a lot about recruitment of workforce. The employer mandate came up because so much of the employment on the reservations is in fact tribal members, and they're talking about they're mandated to buy this health insurance, but yet these same members have a treaty right to that health care. Is there a way to help those those stretched tribal resources go a little further by taking a look at some relief from the employer mandate? Definition of what constitutes an Indian came up over and over again. Massachusetts, Cheryl talked about permanent reauthorization of Indian healthcare. More resources in diabetes, because that is a pervasive problem. Indian employment, again, talking about that issue of buying health insurance. Marketplace access for Native American enrollees who are not living on the reservation. How do they make sure that they're able to get their treaty rights? Talking about mental well-being, talking about culture is prevention. One of my favorite lines that came out of this, Ashley said when we asked about prevention, she said, culture is prevention. We need better access to 1115 waivers. And take a look at the Canadian model, she suggested, that they do more with culturally sensitive, and just the list goes on and on and on of great ideas. And I will tell you, not one of these ideas, Mr. President, not one of these ideas said repeal the Affordable Care Act. Not one of them said, let's get rid of Medicaid expansion. Let's not look at what we can do. And I inadvertently, and I want to make sure that my intern can end on the floor, so I'm going to interrupt myself and ask unanimous consent that Miles Oderman, intern in my office, be granted floor privileges for the duration of today's session on the Senate.
Without objection.
Okay, so let's just all acknowledge what we know who serve on this committee, that we have challenges that far exceed many other populations. And we've come to the floor to talk about how the repeal of the Republican, or the Affordable Care Act, how the Republican health care bill would hurt different populations. We've talked about the elderly. We've talked about children with disabilities. We've talked about rural communities. We've talked about many, many more folks. I think we haven't done enough to talk about what this means for Indian people. And we have a special relationship with Indian people in my state, because every tribe in my state is in fact a treaty tribe with a treaty right to health care. So last night, it obviously became clear that the bill as it stands wouldn't get enough votes to move forward. But we need to keep talking about this bill, and we need to keep talking about what the questions are. And we need to start, instead of talking about this bill or that bill or, all the acronyms, let's start with healthcare. Let's have a conversation about healthcare that starts with healthcare. Where are we doing it right? Where are we doing it wrong? How can we reduce costs? And who's getting left behind? And it's clear to me that in the healthcare world, never mind any of the Affordable Care Act or the Better Health Care, whatever the Republican bill was called, that's a discussion for politics. That's not a discussion for health care. And so let's talk about what Native Americans need. And let's talk about how we have failed. As I said earlier today, Senator Udall led a really important discussion about how we need to preserve Medicaid. I think that when you look at Indian Health Service, I think anyone who really looks at the numbers has to admit that it is chronically underfunded. Last year, I brought the former IHS director to North Dakota to press her on maintaining quality care in our tribal communities. This was especially important because of the severe challenges that Indian healthcare has, and the lack of funding for Indian healthcare, we know, can be critically augmented by three main sources: Medicaid, Medicare, and private insurance. And if every person walking in has the ability to pay, we're going to improve access to care. We're going to improve an opportunity to recruit a workforce. And I can tell you, I think some people may roll their eyes when they say, don't get sick in June. My husband, who's a family physician and practices about 60 miles north of Standing Rock Sioux Nation, he can tell you there have been times when people from the reservation have come to the clinic to see him because the clinic in Fort Yates is shuttered. No money that day, no opportunity for health care. And so people come to get the health care they need, but they have to drive a long way, and it's wrong. And so you see a new doctor that you've never seen before who may not, in fact, understand your conditions. So the Turtle Mountain Band of Chippewa, who was represented today, has over 33,000 enrolled members, of which approximately 14 1,500 actively receive treatment and benefit for services at the local IHS hospital. Thanks to Medicaid expansion and increased enrollment efforts by the Turtle Mountain Band of Chippewa in my state of North Dakota, their Indian Health Hospital is now able to offer so much more in services to their people and increase their outreach and prevention. In June alone, Turtle Mountain's IHS clinic served nearly 13,000, think about that, 13,000 clinical patients and provided over 1,000 emergency room services. Third-party billing revenue has always allowed the tribes to make renovations, has now allowed the tribes to make renovations to their emergency room and their clinic, purchase new medical equipment, including neonatal monitors, recruit and hire additional staff, including licensed professionals, increase staff training and education, provide Wi-Fi throughout the hospital, and expand their behavioral health care facility to serve more patients. Since the Medicaid expansion, they have had a 9% increase in the number of individuals they've served. Their hospital is also experiencing a decrease in the number of uninsured patients. Still too high, in my opinion. Still at 39%. We can get that even lower if we get more people to take advantage of Medicaid expansion. But unfortunately, a Republican health care plan which would eliminate cost-sharing subsidies is making that private health insurance less affordable and less accessible. So let's be honest about how we are affecting our Native American population and talk about the multiple times that this expansion has been so important to our Native families. In North Dakota, the Republican bill would cause an estimated 984 Native Americans to lose cost-sharing reduction subsidies. The Senate Republican health care bill would also get rid of the Medicaid expansion and cap the amount of federal funding states can get to cover those on traditional Medicaid. As a result, it would drastically reduce the amount of Medicaid funding going to the states. This would push the remaining costs to the states and counties that can't afford it. The American Hospital Association estimates that North Dakota Medicaid would lose $1.2 billion. I'll say that again. North Dakota Medicaid would lose $1.2 billion through 2026. Right now, 9,000 North Dakota children and individuals with disabilities, Native Americans, seniors, and low-income families rely on Medicaid for affordable quality care. But this bill would rip it away in so many wrong ways. The uninsured rate for Native Americans has fallen nationally from 24% to 15%, largely due to Medicaid expansion. And so we go on and on. Currently, Medicaid accounts for 24% of the Indian health workforce. Senate Republican bill would strip away $772 billion from Medicaid, and the White House proposes cutting an already underfunded Indian health service budget by 6%. We already know that the per patient cost in the Indian health care system is greatly below that Medicaid reimbursement cost on average. So if we take away Medicaid reimbursement, we're hurting not only the providers, but we are once again making healthcare less affordable. This is a crisis. I can't begin to tell the members of this body what a crisis Indian healthcare is in. We've known it on the committee for many, many years. In fact, Senator Dorgan was the first one to really sound the alarm of the crisis in the Great Plains area, thinking that a report which was so damaging would result in change. Guess what? It didn't. Didn't result in change. But the one thing that we can point to that is a bright, shiny light has been access to Medicaid dollars. It has given them access to capital expenditure. It has given them access to workforce. It's given a more consistent way for people who don't live on the reservations to get health care. And I've said this many, many times. We need to not go backward. We need to go forward. And when people say we're going to take a step back, we're going to reduce actual appropriations by 6% for Indian health, and we're going to eliminate Medicaid expansion. I said, you better look before you take a step backward because you might be off the cliff. That's how dire it is in Indian country. So the one thing I'm going to conclude with is that for many, many years in healthcare, we have not done what we need to do to consult with tribal people. Here's the facility, this is what we're going to provide. Good luck. One size fits all. What we need to do, and what Medicaid has allowed, is that flexibility for tribes to engage, for tribal people to engage in what their needs are, to take a look at those community health models that do dental and eye care and mental health and addiction counseling. All of this needs to be wrapped up. And when people say there is no hope, there certainly is no hope without health. You know, the old saying of when you have your health, you have everything. I can tell you from personal experience, that is absolutely true. That without your health, you know, you could be the richest man in the world, but if you don't have good health, your quality of life is not what it could be. And when we look across the indicators of what's happened in Indian health with Indigenous people throughout our country, when we know this is our obligation, this is a treaty obligation, a treaty right that's been bargained for, shame on us. So Medicaid can be that bridge, can be the bridge to better quality care. And that's why it's so critical, Mr. President, and to my Vice Chairman, that we be out here speaking for our communities, speaking for these unique group of folks who depend so much on Medicaid expansion, but also depend on us to do a better job, to be better stewards of that relationship, to be better citizens as it relates to living up to the obligations that our ancestors negotiated. And so with that, I would ask that everybody who hasn't really been exposed to this issue, you know, read the articles in the Wall Street Journal. But don't just read them and wring your hands and say, this is horrible. Take a step to change the outcome. Don't just read them and say, boy, that's horrible. Take responsibility for what you read. Because every one of us in the United States Senate and in the Congress, we are all responsible for fulfilling the obligation of these treaties. And when we aren't doing it, it is a failure on every one of us. And it's a failure of some of the most vulnerable, to protect some of the most vulnerable people in our country, and that's Native American children. So with that, Mr. President, I yield the floor and turn it back to my Vice Chairman, Senator Udall.